you mentioned, stress, talking about stress, and you said in the book that stress is as a body's response to a demand for change. And actually, you have eustress and distress, and acute stress, chronic stress, and you mentioned inflammation. We have acute inflammation and chronic inflammation. Stress and inflammation aren't necessarily bad for us. So could you just elaborate on that a little bit?
Sure. So there's 6 big concepts you mentioned there. So if you break stress into eustress and de-stress or distress, that's sort of an old concept. Hans Sale, he's the one who came up with this concept, which is basically your response to different types of stress. So a eustress is your response to a positive thing that happens in your life, like a birth of a child, which could eventually become de-stress also because of the lack of sleep, etc. But at the beginning, when the baby comes, or a promotion, or a marriage, those are sort of eustress. And de-stress or distress is typically things that are going to cause trauma to our bodies, things like losing a job or a broken relationship. Those are things that cause distress. Well, the problem with eustress and de-stress is that eventually, we all have moments of both of them. The goal is obviously to have more eu than de-stress, but so much of the time, the longer you have any of those stresses, they become sort of more chronic and they become inflammatory. So you've got eustress and de-stress, and then you brought up acute and chronic inflammation. So despite the stress, eustress is typically a short-acting stress. Usually you have this great joy, and then eventually it just sort of subsides. Unfortunately, de-stress often has the ability to become more chronic. And so let's break up the concepts of acute and chronic inflammation, and then we'll go back to how stress fits in. So acute inflammation is, I hurt my leg, I scratched my arm, and your body sends an inflammatory reaction to it. Well, that's very normal. You need that. You need inflammation because you have a cut, and you got to send over, oh my God, I got to send over all my white cells, and I got to clear up the infection. I got to send over the platelets. I got to heal the area, and I got to send over, and all that causes inflammation. That's why you get swelling. I have a big swollen, actually, my bees bit me. I got a bite this weekend, and so I have a big swollen arm. So that's all inflammation. If you can see my arm is all swollen. And so that's all acute inflammation in response to an acute event. But when you have this constant state of de-stress or constant amounts of stress that happen for a long period of time, that acute inflammation becomes chronic. Well, what's the big deal? Well, in acute inflammation, your heart rate goes up for a short time, your blood pressure goes up, your inflammatory cells come over, they heal the problem, and then they go away. But then if you have inflammation for longer periods of time, it becomes more chronic, then you have all those cells that are hyperactive for long periods of time. And they don't just stay in this one place, then they move to other parts of your body, and then they can trigger inflammation and illness in other places. A perfect example of this is celiac disease. I like people to think about celiac disease in particular because it's such a important way to understand how what you do acutely can affect you chronically. So celiac disease is allergy to gluten or wheat gluten. And so people who don't know they have celiac disease will often eat wheat for years. And so they eat wheat, so they have a genetic predisposition where they cannot eat and process gluten. That's different than gluten sensitivity, which if you want to talk about later, we can, but this is gluten allergy. That's a very distinct thing. That's celiac disease. So when people eat wheat, initially what happens in their gut, and again, we're getting into the gut, which is a whole nother talk, but when you have in the gut, what happens is you break open your gut cells, and all of the inflammatory cells are triggered by that wheat. That wheat comes into your body, it enters your blood, the toxins enter your bloodstream, and your body mounts an acute attack, and it attacks the gluten, and you get a little bit of inflammation. So that's okay. But what happens is people who don't know they have gluten allergy, they continue to eat it over and over again. And so what happens is that it goes into that gut again, breaks those junctions, gets into the body, all the toxins get in the body, and that lasts all for hours and hours and hours. And you get this chronic state of inflammation with these patients with celiac disease. But it doesn't just sit in the gut where you ate that wheat. It goes everywhere. And that's important to understand, is that inflammation goes to your joints and you get joint pain. It goes to your head and you can have seizures and headaches. It goes to your skin and you can have rashes. So celiac disease is a perfect example about one thing that you eat goes into your gut, but doesn't just affect your gut, although it affects the gut, but it triggers a systemic inflammatory process. So there's so many things that can happen where you create this chronic inflammation, which then triggers this sort of systemic illness, for me, autoimmune or rheumatoid arthritis. And so everybody has their genetic predisposition, so that's going to trigger whatever that predisposition gets activated, and they're going to be more prone to that illness. So you said eustress, de-stress, acute and chronic, and you brought up two more.
Acute and chronic stress and acute chronic inflammation.
Okay, so again, just to sort of emphasize, acute inflammation is not bad. Inflammation in the acute phase is not a bad thing. We need acute inflammation. We need to be able to live. That's how we handle all of our acute problems. The problem is no one just has acute inflammation anymore. We have so much chronic inflammation because our bodies are constantly in these states of de-stress where we're constantly being forced to deal with all these inflammatory states for hours and hours and hours, which then is creating systemic illness. So it's kind of a chain to kind of think about, is that one thing leads to another, which leads to another. So the key in medicine, we say, oh, well, we'll treat the illness because that's the downstream, and that's, we as scientists, we see the illness and that's what we want to treat. But wait, why did that person get that illness? Why did I get rheumatoid arthritis after I had my third kid? Let's go back a little bit and say, let's find the triggers back here which triggered the inflammation so that we can then suppress the illness.